it's me again. In this lesson, I want to cover vitamins and minerals that are required to keep both the mother and the baby healthy. Usually, a woman is able to obtain most of her nutrients from a diet. However, during pregnancy, as the baby draws on the mother's nutrient stores, some vitamins and minerals are required to be taken in excess. So in this lesson, I will only cover the vitamins and minerals that are required in excess. If you're looking to find out any more on other nutrients, then head over to the tabs above this video. In the materials tab, you will find a full list of vitamins and minerals, as well as notes and slides for this video. Anyway, let's just get started. Firstly, vitamin A. Vitamin A is vital for healthy vision, especially in the dark, and also for human growth and development of all tissues like skin and muscle. Although vitamin A is necessary for the healthy growth and development of the baby, it's important not to take any excess, as this can damage the fetus. For women aged 19 to 50 years old, the recommended intake is 600 micrograms per day, but this increases by 100 micrograms if a woman is pregnant, and if she is lactating, she should increase her intake by 350 micrograms per day. Aside from supplements, vitamin A can be obtained from milk, cheese, eggs, kale, spinach, and sweet potatoes. Again, more on sources and vitamins is located in the materials tab. The second vitamin is vitamin D. This one is essential for absorption of calcium and phosphorus. Now, because calcium and phosphorus are essential for the health and development of bones and teeth, that makes vitamin D essential for bones and teeth too. There is no set reference nutrient intake, also known as RNI, for vitamin D in the UK, but it is suggested that 5 micrograms is enough. If a woman is pregnant or lactating, she should consume 10 micrograms more. Now, vitamin D can be obtained from natural sources, but mostly you get it from the sun. But because, for example, if you live in an area that doesn't have much sun, like Scotland or the UK, for example, then supplementation is usually recommended. The next vitamin is vitamin C. Vitamin C is vital for producing collagen. Collagen, on the other hand, is essential for bones and connective tissues like ligaments. In addition, vitamin C is also high in antioxidants, helps wound healing and iron absorption. The ordinary intakes are recommended at 40 milligrams per day, but if a woman is pregnant, she should eat 10 milligrams more, and if she is lactating, she should consume 30 milligrams more per day. Vitamin C can be obtained from citrus fruit and green vegetables. You need to be careful with vitamin C because it is also easily destroyed by heat, alkali, processing and handling, so take caution when cooking it. The next nutrient is thiamine, also known as vitamin B1. This nutrient is vital for releasing energy from carbohydrates, making it vital for the brain and nerves, as these use carbohydrates for functioning. The usual recommended dosage for women is 0.8 milligrams per day, but a pregnant woman will need to increase that intake by 0.1 milligrams per day in the last trimester only. If the woman is lactating, she will need to take 0.2 milligrams per day. Now, B1 can be obtained from nuts, pulses, pork, green vegetables and fruit. Riboflavin, also known as B2, supports energy release from fat and protein. For women between the ages 19 to 50 years old, the recommended intake is 1.1 milligrams per day. However, if she is pregnant, she should take an extra 0.3 milligrams per day. On the other hand, if she is lactating, she should consume an extra 0.5 milligrams per day. Usually vitamin B2 can be obtained from liver, milk, cheese and yogurt. Let's just keep going with the vitamins. because there are a few of them. So niacin, also known as B3, is required for a number of processes, including energy production from protein, fats, and carbohydrates, as well as the metabolism of folate and vitamin C. It is also vital for the growth and development of skin, digestive process, and the nervous system. Women from age 19 to 50 are recommended to take 30 milligrams per day, but women who are lactating should consume an extra 2 milligrams per day. Naturally, niacin can be obtained from liver, shellfish, nuts, and legumes. B12 is required for normal growth and development. It also plays a vital role in the function of the nerve cells, as well as production of red blood cells. Usually, women between ages of 19 to 50 are recommended 1.5 micrograms per day, but if they are lactating, they should consume 0.5 micrograms more per day. Naturally, B12 can be obtained from eggs, milk, and meat. Vegetarians may need to use supplements. Folate plays a crucial role in the manufacture of DNA and is important for normal growth and development, as well as the production of new cells. Together with B12, it helps produce hemoglobin in red blood cells. During pregnancy, folate prevents neural root defects in the developing fetus. Women aged 19 to 50 are normally recommended to consume 200 micrograms per day, but when they are pregnant, they should consume an extra 100 micrograms per day throughout the whole pregnancy. In weeks 1 to 12, they should take an extra 400 micrograms per day as a supplement. Folate can be found in foods like liver, green vegetables, nuts, and wholemeal bread. Calcium is vital for the formation and maintenance of bones, teeth, blood clotting, and nerve function. Women are normally recommended to consume 700 milligrams of calcium per day, but when they are lactating, they are recommended to take an extra 550 milligrams per day. Calcium can be naturally obtained from milk, cheese, yogurt, and canned fish. Magnesium supports the formation of both bones and teeth and collaborates with minerals like calcium, sodium, and potassium to support the transmit nerve signals and muscle contraction. Normally, women aged 19 to 50 are recommended 270 milligrams per day, but when they are lactating, they should consume 50 milligrams per day more. Magnesium can be obtained from meats, spinach, and nuts. The next vitamin we have is zinc. Zinc is present in all tissues. It is essential for growth, repair, and sexual maturation. In addition, it is involved in the major metabolic pathways and supports the immune system. The usual recommended intake is 7 milligrams per day, but this increases during lactation by 6 milligrams per day in the first 4 months, and 2.5 milligrams extra per day after 4th month. Zinc is usually obtained from meat, eggs, and whole grain cereals. The next mineral we have is copper. Copper supports the immune system and helps the body metabolize iron. The usual recommended intake is 1.2 milligrams per day, but increases by 0.3 milligrams per day during lactation. Copper can be obtained from liver, shellfish, nuts, and seeds. The last one, but not least, of course, is selenium. Selenium plays a vital role in the immune system and protects cells from oxidative stress. The usual recommended intake is 60 micrograms per day, but increases during lactation by 15 micrograms per day. Selenium can be obtained from meat, fish, eggs, and grains. Okay, so that's all the vitamins and minerals that are required in excess during either pregnancy or lactation, or both, I suppose, as you would have seen from the presentation. I hope that you've enjoyed today's lesson, and if you have any questions, please don't hesitate to reach out. But yeah, that'll be all for today's lesson.